Good evening, wherever you are. This is Diego Vale from ConferenceHype. Our segment will focus on the diversity of transplant glomerulitis and its relationship to alloantibody, from the 2026 May edition of Kidney International Reports. Background introduction. Although transplant glomerulitis often signifies antibody-mediated rejection, the pathophysiology of complement degradation, split product 4D staining of peritubular capillaries, and donor-specific antibodies negative cases is unclear. Methods. We compared Banff 1997 defined glomerulitis using serological and pathological dichotomization against rejection without glomerulitis and normal controls. Results. Epidemiological risk factors were female recipients, living donation, early T-cell-mediated rejection or AMR, and previous corticosteroid rejection treatment. Discussion. Glomerulitis is a heterogeneous biological lesion that frequently signifies AMR. However, TCMR or innate cellular inflammation caused many DSA and or C4 DPTC episodes. From the 2026 May edition of Kidney International Reports. Background, introduction. The use of chimeric antigen receptor T-cell therapy for relapsed or refractory post-transplant lymphoproliferative disorder in solid organ transplant recipients is a rapidly evolving frontier in immunotherapy and transplantation. Methods. To address this gap, we conducted a systematic review of published data pertaining to CAR T-cell therapy and PTLD after solid organ transplantation. Results. Our findings reveal substantial variability in immunosuppressive management before and after CAR T-cell infusion, including the withholding of immunosuppression or the use of single-agent or combinations of corticosteroids, calcineurin inhibitors, antimetabolites, or mammalian target of rapamycin inhibitors. Discussion. Our review underscores the necessity of an individualized approach to these patients that accounts for factors such as CAR T-cell persistence and prolonged B-cell depletion, and highlights the need for further research on this clinical scenario. From the 2026 May edition of Kidney International Reports. Background, introduction. Kidney diseases are a global health concern. Methods. The survey was distributed to European clinical centers. Results. Participants expressed positive views about data sharing and AI use on a normalized scale from -1 to 1. Discussion. Renal clinical study participants generally support data sharing and AI use, although views on AI are less favorable in patients than healthy volunteers. From the 2026 May edition of Kidney International Reports. Mendelian randomization leverages the random assortment of alleles at conception to investigate how genetically mediated changes in an exposure affect an outcome, while minimizing concerns related to reverse causation and unmeasured confounding. Initially applied to assess the causal impact of modifiable traditional risk factors as mediators of disease risk, Mendelian randomization studies now incorporate large-scale multiomic datasets, providing valuable insights for drug target discovery. By analyzing cis-genetic changes that affect gene activity or protein levels, using advancing techniques like single-cell sequencing and proteomics, Mendelian randomization can identify new therapeutic targets, predict drug target efficacy and effect size before trial development, anticipate adverse effects, reduce late-stage trial failures, and identify opportunities for drug repurposing. This review explains the basic principles, broad applications, and inherent limitations of Mendelian randomization in drug target identification, validation, and repurposing within the context of kidney disease. This concludes ConferenceHype's coverage of the May 2026 issue of Kidney International Reports. Did we miss an article, or which finding deserves a deeper follow-up? Tag us on X and join the conversation. If this review helped you keep up, please like the video and subscribe so you do not miss the next broadcast.
This is Conference Hype. Stay with us, coverage continues.
From the 2026 May edition of Kidney International Reports. Background, Introduction. Although fatty liver disease is a known risk factor for chronic kidney disease, its association with kidney failure remains unclear, especially after its redefinition as metabolic dysfunction-associated steatotic liver disease. Methods: we used 187,881 individuals with CKD from medical screening data of the National Health Insurance Service database of Korea. Results: the study population had mean age of 63.3 years, with 58% females. Discussion: in this large-scale observational study, MASLD was associated with kidney failure in individuals with CKD. From the 2026 May edition of Kidney International Reports. Background, Introduction. Chronic kidney disease of unknown origin is a form of progressive kidney damage not attributable to traditional causes of CKD that has been observed primarily among agricultural workers in Central America and South Asia. Methods: a literature search across multiple databases was conducted on August 16, 2024, with an update on November 12, 2025. Results: 8 articles met the final inclusion criteria. Discussion: few workplace interventions have been studied for their ability to prevent CKDU. From the 2026 May edition of Kidney International Reports. Background, Introduction. Steroid-resistant nephrotic syndrome is the leading cause of chronic glomerular disease in individuals under 25 years of age. Methods: analysis of 208 individuals with pathogenic NPHS2 variants was conducted, which is the largest reported single cohort. Results: a broad allelic spectrum with variable disease onset was identified. Discussion: this study delineates genotype-phenotype relationships in NPHS2-associated sRNS and proposes high-order podocin assemblies. From the 2026 May edition of Kidney International Reports. Background, Introduction. This study aimed to externally validate the performance of the kidney replacement therapy risk prediction calculator for chronic kidney disease in children in an ethnically distinct East Asian population. Methods: we externally validated the KRT risk prediction calculator for CKD in children using data from the Korean cohort study on outcomes in pediatric CKD cohort. Results: overall, 533 children were included in the validation cohort. Discussion: these findings underscore the potential utility of the calculator in improving prognostication and clinical decision-making in pediatric CKD. This concludes ConferenceHype's coverage of the May 2026 issue of Kidney International Reports. Did we miss an article, or which finding deserves a deeper follow-up? Tag us on X and join the conversation. If this review helped you keep up, please like the video and subscribe so you do not miss the next broadcast.
This is Conference Hype. Stay with us, coverage continues.
ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 May edition of Kidney International Reports. Background, Introduction. The incidence of kidney stones is increasing in Australia and Aotearoa, New Zealand, increasing pressure on emergency departments for acute pain management and stretching nephrology and dietetic services tasked with preventing recurrence. Methods: guidelines were developed through a 5-stage process aligned with the grading of recommendations assessment, development, and evaluation approach. Results: these guidelines provide recommendations on the diagnosis, metabolic evaluation, and management to prevent recurrent kidney stones. Discussion: these CARI guidelines address a critical gap in the management of kidney stones in Australia and New Zealand by providing evidence-based, contextualized recommendations to support nephrologists, dietitians with expertise in kidney stones, and other health professionals in delivering consistent, high-quality care that reduces kidney stone recurrence and improves outcomes. From the 2026 May edition of Kidney International Reports, osteoporosis and chronic kidney disease, metabolic bone disease are increasingly recognized as overlapping conditions, particularly in the aging population. Declining renal function and skeletal fragility often coexist because CKD-MBD may develop in a skeleton already compromised by pre-existing osteoporosis. Dynamic bone, often resulting from excessive suppression of parathyroid hormone and now a common form of renal osteodystrophy, may histologically resemble low-turnover osteoporosis. Distinguishing between the two under light microscopy remains difficult, and reliable differentiation often depends on clinical context. Nevertheless, nephrologists and non-nephrologist bone specialists frequently work in parallel rather than in collaboration. This separation has contributed to persistent diagnostic gaps and fragmented management, especially in patients with advanced CKD. Advances in imaging, biochemical markers, and bone histomorphometry have improved insight into disease mechanisms. However, limitations in current diagnostic approaches remain. From the 2026 May edition of Kidney International Reports, Background Introduction, we evaluated the effectiveness of a web-based patient decision aid developed for older adults with end-stage kidney disease and their caregivers, integrated into kidney care counseling. Methods: a pragmatic pre- and post-trial with a comparison group was conducted in Singapore with patients aged greater or equal to 70 years with ESKD and their caregivers. Results: a total of 143 participants were enrolled. Discussion: although future studies are needed to confirm these results, this study provides preliminary, suggestive evidence that integrating a web-based PDA into kidney care counseling may reduce caregiver decisional conflict, improve patient awareness of CM, and shift both stated and actual treatment choices away from dialysis. From the 2026 May edition of Kidney International Reports, Background Introduction, efficient communication between dialysis and kidney transplant centers is crucial to move patients through the transplant process. Methods: using a convergent mixed methods design. A process evaluation was conducted in 2023 to assess the dialysis and transplant center staff implementation of electronic transplant referral and communication programs according to the reach, effectiveness, adoption, implementation, and maintenance framework via surveys and interviews. Results: overall, 101 dialysis and 30 transplant center staff completed the survey, and 84% reported using electronic transplant referral and communication programs. Discussion: electronic transplant referral and communication programs may streamline kidney transplant referrals and enhance communication. However, implementation varies between dialysis and transplant center staff. This concludes ConferenceHype's coverage of the May 2026 issue of Kidney International Reports. Did we miss an article, or which finding deserves a deeper follow-up? Tag us on X and join the conversation. If this review helped you keep up, please like the video and subscribe so you do not miss the next broadcast.
This is Conference Hype. Stay with us, coverage continues.
This concludes ConferenceHype's coverage of the May 2026 issue of Kidney International Reports. Did we miss an article, or which finding deserves a deeper follow-up? Tag us on X and join the conversation. If this review helped you keep up, please like the video and subscribe so you do not miss the next broadcast.
This is Conference Hype. Stay with us, coverage continues.